All right, hello. My name is Sue Hawkins and I'm a psychologist in private practice. I've also got a strong background in medical science and genetic counselling, and so working with people with genetic conditions has been a strong interest of mine. Today I'm focusing on a topic that's not usually much talked about in genetics. In fact, when I brought it up as a suggestion, there was a fair bit of squirming. So, why talk about shame? Brené Brown, the well-known shame researcher, says, shame is the intensely painful feeling or experience of believing we are flawed and therefore unworthy of love and belonging. Basically, she says, the less we talk about shame, the more power it has over our lives. And we need to cultivate an awareness of it and name it and speak to it. And therefore, we can definitely reduce it. It's a highly destructive emotion, and it's important we do that. The other reason I wanted to bring shame up was to acknowledge that there's many genetic conditions can induce shame. For example, some of them that negatively impact on appearance. Thinking of that, I'm thinking of the elephant man who had to cover his head the whole time. There's disorders of metabolism that generate unpleasant, strong odors and make people feel that they're socially isolated and feel horrible about themselves. And that's the area of one of the areas I'm talking about today, in particular, the Trimethylaminuria. That's the one I'm talking about today. And there's other genetic conditions such as the mitochondrial diseases or Huntington's that can result in basically decline and odd movements, and people feel very ashamed of themselves when they go out. They can't hold a cup. They do unusual tics and things like that. And there's secondary shame, which can be sometimes when you've I find that a lot with women who have been diagnosed with a genetic condition when they're pregnant and they have to terminate, and the shame associated with termination and speaking about it to others is quite high. So the aims of my presentation are to basically reduce the power of shame, and by do that in a way of trying to understand what is shame, understand the underlying biology of shame, and with the focus on the genetic condition, Trimethylaminuria, TMAU, which is easier to say. And also understand the impacts of shame, how it impacts on us. And look at ways that we can reduce shame, which is associated when you have TMAU. So what are the facts about shame? Well, shame is a universal emotion. It basically directs all our focus inwards, and we view our entire selves in a negative light. We are bad. As opposed to guilt, which is something I did is bad, shame is the self is bad. It's actually arisen because it's an evolutionary warning tool for us that our social bonds are in jeopardy. Women in adolescence feel shame actually more than adult men do. And as we get older, when we go into middle age, shame decreases. But as we age even more, shame increases again. And shame has been linked to a pile of anxiety disorders and depression, and also ill health. So it's a very important emotion to have some sort of ability to regulate yourself with. So with the causes of shame, because it's evolved through social connections, it's a universal human defense mechanism. And what it does do is when we recognize or think that we're inferior to others and we cause others to have aversive feelings. And it's also when we recognize that we don't actually live up to the social expectation. When actually faced with shame, the brain goes into like a fight-flight response. It doesn't actually happen till around 2, so babies don't feel shame. And it's associated with this region in the back of our, sort of behind our frontal cortex, which is called the, I can't say this one very easily, perigranule anterior cingulate cortex. And the front lobe basically is switched off, our wise brain turns off, and our fear center starts switching on. And what it does, it makes us want to hide. Everybody can see if someone's ashamed, they're hiding. Their eyes are averted, their body's collapsed, and people sweat and they feel very sick because their adrenaline pops up because of the fight-flight response. And shame also makes us have internal words, which is sort of like, I'm not good enough. I'm a fraud, I'm not worthy, I'm not lovable, I'm broken, I'm not enough. And those words, again, keep us in shame, keep us away from others. And shame also makes us engage in behaviours which aren't helpful, and they can be self-destructive. People can turn to alcohol or drugs to cope with shame. They can attack others. They can be violent. They can binge eat. Shame is very much associated with binge eating and also with depression. So again, the focus on the metabolic disorders and shame, because these disorders can set up a person to feel ashamed, because what they do is they induce an automatic disgust response in the other, triggering that feeling of being an outcast. And it's important to in all this, while remembering it's also really hard, it's also to remember it's not personal. Sometimes it's just biology. And I know that's an easy thing to say, but there is a biological reason why people react that way, and that sometimes helps to just remember that. So I'm just going to go into that a little bit as well. But in terms of metabolic disorders, there's actually a lot of them that induce odors, which are, can be a shameful experience. I'm just listing a few here. And as again, I'm going to focus on the TMAU one for the purpose of this talk. So just a little bit to talk about the biology of smell, olfaction. Humans actually probably have less developed olfaction than other animals, but we can still pick up about 10,000 different odors. And smell is the only sense that connects directly to the brain. So it's immediate, it's fast. People will react, not respond to a smell. And that's an important thing to remember. And it also hits our amygdala, which is our fear center. So if we smell something bad, we are triggered into a fear response. And women have a keener sense of smell than men because they've got more olfactory nerve cells. And that actually increases during ovulation, which sort of makes sense. It's a defense against something bad. When you're about to produce an egg, you want to make sure that you're not next to anything that's going to cause you a problem. And olfaction also declines with age. What's good to know is that if you're constantly or repeatedly exposed to a smell, your ability to perceive it declines. It's called adaptation. And that can last for a few weeks. So sometimes that's why families with TMAU sufferers don't always smell their smell, because they're constantly adapted to it, so it doesn't affect them. And people are also more likely to adapt if they believe it's a natural, non-threatening smell. So that's where education can be helpful. And again, odor detection and preferences vary from person to person, and they can depend on cultural, social, and genetic factors. So some people with TMAU have a partner that doesn't even smell them at all the time. So along with smell, the first reaction of smell can be disgust. And that's a universal ancient emotion. It's there because of the need to drive hygienic behavior. Unfortunately, it's sort of more evolved to be quite self-directed. People be disgusted in their bodies, or as a moral emotion, people can be disgusted when people kill somebody and things like that. But smell, taste, and touch are big triggers of disgust. Vision and hearing can also elicit the emotion by just memory or imagination. And culture and experience can also trigger disgust. But interestingly, babies don't experience disgust. So it's, in some ways, it's got a bit of a learnt space to it. Again, in the brain, it's associated with a bilateral activation of the anterior insula and elicits a strong visceral emotion. So it's a body emotion. And again, it makes us behave, react, as opposed to respond to that trigger. So its function is a contamination response to get away or block off or eliminate something we find offensive or toxic. And animal products that have the most triggers. There are dangers to discuss as well, because while there's benefits in terms of an evolutionary perspective, it causes a lot of human suffering once people are experiencing someone just feeling disgusted in them. But what's important to realize that intimacy also lowers the threshold for what we consider disgusting. So that allows us to change nappies for babies, even though they're full of poo, and allows us to care for sick people, even though they may not smell the best and they're sort of vomiting and things are going on for them. So intimacy can definitely change discussed. So again, with the TMAU gene, just to, I'm sure it's been spoke about before, but it's due to a defect in the flavin-containing monooxygenase 3 gene, FMO3, and that encodes an enzyme that breaks down the trimethylamine. Trimethylamine itself is a substance that causes a smell. It's inherited in an autosomal recessive genetic trait, but their secondary trimethylaminuria can happen too, with kidney and liver damage, or by an increase in dietary precursors to trimethylamine, which happen, such as choline or lectin or carnitine, which is from meat. It's really difficult to diagnose sometimes, and it's not well known by doctors or in wider society, so diagnosis has often been a problem. And sufferers secrete it in their sweat, tears, breath, and reproductive secretions. It doesn't affect your lifespan or development, and symptoms include the classic fish odour, rotting eggs or garbage. And the odour can be constant or it can come and go. So it's a very hard disease to live with, and tricky to also treat and diagnose. So here's just a video just talking about some of those diagnoses and social impacts.
24-year-old musician Cassie from London has suffered with a bad body smell for as long as she can remember.
If I can smell a smell in the room, I immediately think it's me, and I'll immediately kind of panic if there's a lot of people in the room. And it's made me quite paranoid.
It was just a really, really bad odour, and I couldn't work out what it was. I thought she was sick at first, actually.
A lot of the time people just think, oh, maybe you're not clean, but you can be the cleanest person in the world and you will smell like you haven't had a shower in weeks.
And even worse for Cassie, her smell is not typical stale sweat.
Whenever you go to a fish market that's just shutting down, and there's just that lingering smell of fish that's kind of the end of the day fish that's kind of been sat out in the warm, and that's what I smell like.
Cassie's fishy odour has made her very self-conscious. Although it comes and goes, it affects every aspect of her life.
Because it gets quite hot in the pub, and then we're running up and down, and I'm always quite conscious of the customers maybe getting a whiff of me and being a bit like, oh, what's that? Don't want to go to her. Even when I go to the gym, I'm always very conscious if I'm in changing room afterwards that someone will smell me and think that I stink like rotting fish.
Cassie also sings in a band, where she's often even more aware of her smell.
I'm probably a lot more conscious about it when I'm sweating, so if I'm on stage performing and there's big heavy lights.
When you finish a set and everyone wants to come up and say, hello, that was amazing, really enjoyed that. Oh, it's so nice to see you. I haven't seen you for And it's always a bit awkward, and I'm thinking, oh, I hope I don't smell. I hope that's not like their first impression of me, is that I stink.
Normal body odour tends to start around puberty, but Cassie's pungent fishy smell started when she was much younger.
Cassie started sharing a room with her sister when she was 3 years old, and there's 10 years between them, so it was quite tricky at first. And her sister came to me and said, Mum, she smells really bad. What's she eating? She's just stinks. And at first I was like, oh, you're just being really mean. So I went in, and the smell was definitely coming from her. It was almost like it was coming out of her pores. That's when I started thinking that there really is something not right, and I took her to the GP to find out what was going on.
He was a family doctor that we'd been seeing my whole life, so we knew him. And we talked about it, and the doctor basically didn't want to know about it, pretty much laughed it off, said that this wasn't a real problem and it wasn't a real condition. And it was kind of a thing of, oh, maybe I didn't wash properly, or basically that sort of thing. It was kind of irritating that every time I tried to speak to anybody about it, they didn't really want to listen, and a lot of people didn't believe me.
With no idea what could be causing her to smell of rotten fish, Cassie has had to do her own research.
We kind of looked at all the possible things it could be. I've even looked into irritable bowel syndrome. I've looked into all sorts of things that are kind of similar. It just was so frustrating.
Every body odour is unique and most of the time harmless, but some smells can indicate a health problem. If your sweat smells like bleach, it could point to a kidney or liver disease, while a more fruity smell might signal diabetes. Cassie wants to find out what's causing her fishy smell. Made an appointment with a specialist in metabolic medicine.
Oops.
LG Interview Door in Door.
Right. Okay, so Cassie's story gave a bit of an idea of what was going on for her. And it is a very psychologically and socially a very tricky condition to live with. A lot of sufferers get exposed to bullying and name calling, especially around what they smell like. Sometimes they also say family support is limited, and it may be because families are adapted and they actually don't smell them as much. And the sense of social isolation is huge, that worrying about every time you go out, what's going to happen. What they tend to do is a lot of overzealous washing, like 15 showers a day, brushing your teeth 10 times a day, and people say you still smell. There is an issue with the medical system being ignorant of this condition, and therefore difficulty in trying to find the diagnosis or someone that will take you seriously. Again, the paranoia that happens in social situations and anxiety, people will be up all night thinking about what's going to happen in the social situation. Levels of depression can be exceedingly high, and people have been known to suicide from this because of both depression and social isolation. So it's quite serious. And employment is tricky too, because employment means working with people, and that can be a very, very tough thing if you're smelling bad every day. And the quality of life then tends to decrease, and divorce levels are high too. So this next video talks about the work issues that people face, and also a bit more about the diagnosis.
I would take 15 showers a day and then soak in the tub 2 or 3 hours just because I thought it was bathing. I didn't know what it was. I want to be clear for the viewers today, I'm not a medical doctor. They see the PhD, they think I'm in a scientific field. I'm not, so I want to be real clear. So my interpretation may be a little different than perhaps some of the scientists. But basically what it is the FMO3 gene that has a mutation on it. And that mutation usually prohibits the liver from breaking down byproducts of protein. Therefore, the trimethylame, it just doesn't pass normally as it would with someone without the FMO3 gene mutation. And that usually builds up in the body, and it can come out in a patient's breath, sweat. I've heard of it in their scalp, the tear ducts in their eyes, any opening. Oftentimes, this disorder causes paranoia, as you can imagine. When you see someone do that, it might not even be the TMAU patient, but because they've been ridiculed and so many condescending comments, they immediately think that it's them. And then sometimes they'll get into stress mode. And what happens when we have stress? At least me, I start to sweat more and so forth, and that makes it even worse. So it's a never-ending circle. For some people, the diet, the low-colon diet, using low pH soaps seems to help. Unfortunately, for others, nothing really seems to help. Many physicians will assume, due to their training, that it's a psychological problem. For example, it took me 3 years going from doctor to doctor before one doctor finally said, okay, I'm going to give you this test. It's about $650. Now, I know for perhaps maybe you or I or someone, you're saying, well, what's the big deal, Cheryl? Well, some of the people, and I'll talk about this later, with TMAU are either underemployed or unemployed. Social Security doesn't recognize TMAU as a disability. So $650 cash for someone who's not working and barely paying their mortgage or rent can be phenomenal. phone interviews, they always tell me, Cheryl, wow, you know, you're a perfect candidate. And then you get flown down and you can tell that the faces, the enthusiasm just kind of just drain out of them. If you do get a job, it's a battle to keep it. And people have told me, Cheryl, I've walked into work every day, there's soap on my desk, there's detergent. That hasn't happened to me, but I can only imagine how they must feel walking in every morning to that. There was someone who just called me a couple months ago out of Washington, D.C. And one of the things, and this employer wanted to help, one of the things I told the employer, why not move Jane's office down to the end where it's not as many people, and there was 2 windows there. And from what they're telling me, I got an email from her boss and it's working great. For those of you watching today, you're not alone. It may seem that way, but for those of you watching, my phone number's on the internet and I get calls at 3 in the morning. So you're never alone. Call me, call the other support groups, email. If you're in town, they can come by and visit. I've been invited to people's homes and so forth. There's support groups all over. You can Skype now. They have meetups where people that have this disorder or people who are interested in it can go and learn. It's usually a weekend retreat. So things that I didn't have that they do have. So you're never alone. You may feel alone, but you're never alone.
A group by training, and
I'm sorry about this. This is tricky when you put something on in terms of slides.
interest has been the
Okay. All right. So how do we overcome the gene-induced shame? So I'm going to talk about that in learning how to stop the shame spiral, using self-compassion, learning to create regular shame-free bubbles, education, connection, support groups is sort of what was Cheryl just talked about, therapy itself, and just personal self-care, especially by keeping medically informed of the latest developments and things that you can actually use to help reduce smell. So Brené Brown states the antidote to shame is empathy. And she says there's 4 steps to basically stopping the shame spiral. First is to recognize it's actually shame that's going on for you. And you can recognize this by noticing your body reactions, because you'll want to hide, you'll want to go away. And know what its triggers are. Understand that it's triggered by somebody reacting through an evolutionary basis to an odor that's causing a reaction in them that's making you feel like you're an outcast. And when you feel that, you want to just hide away. And give yourself a reality check saying, well, okay, that's sort of what's going on. But shame is saying to you, I'm all bad, but that's not true. It's just that you have a condition that creates an odor which people find it difficult to react to. And to do that, you need to speak to yourself like you would someone you love. That's what she's saying. And I'll go into the self-compassion part because that's where that comes in. And then you need to reach out to someone you trust. Someone that you know you can talk to about these feelings, because you need to speak your shame. Say, that was horrible when that happened to me. I just felt like curling up in a ball and just hiding away. And when someone says, yeah, I really get that, I'd feel that way too. It just takes away the power of shame. So what is self-compassion? Basically, it actually means you are being kind and understanding to yourself when you are confronted with perceived personal failings. And it requires 3 things: mindfulness, compassion for self, and seeing self as part of the human experience. And we give self-compassion to ourselves just because we feel pain, for that reason, not to feel better. It's sort of a bit of a byproduct of it, but it's basically just because we feel pain. And it's not self-pity. People say, I can't be that, it's self-pity. It's not that. It's just recognizing the pain you are feeling. And it's not self-judgment or self-esteem. It's something different. And I will let Kirsten Neff, who's the founder of Self-Compassion, the main researcher, tell you about it.
First thing is just to give yourself permission to treat yourself kindly. A lot of people think that it's selfish or that it involves self-pity. It's really not. Remember, self-compassion recognizes the shared human condition. It's not, woe is me, poor me. It's, oh, life is difficult for everyone. So, and again, because it helps you give more to others, it's not selfish. So giving yourself permission to be kind, knowing that it's going to help you be happy, it's going to help others be happy. Then concrete things like noticing how you speak to yourself, asking, would I say this to a close friend? Usually not. What would I say to a close friend? Can I try treating myself that way? You can do this in letter writing. It's very effective. If you're really struggling, write yourself a letter in the same way that you would, again, what you would express to a good friend in the same situation, but write that to yourself. And then you can go back and read it. That's helpful. Probably one of the most helpful things, though, because we're mammals, we are programmed evolutionarily to respond to warmth, physical warmth, soothing touch, and gentle vocalizations. As mammals, when we, just like think of a mommy lion and her cub, we're programmed for our bodies to calm down and to feel safe and to feel soothed. So one of the most effective ways to give yourself compassion is through some physical gesture, because you're actually tapping into that mammalian caregiving system at a physiological level. So finding some touch that feels comfortable. A really common one might be to put both hands over your heart, or maybe on your belly, or cradle your cheeks, or do something like this. Some people just holding their hand. That can let your body know that you care. And then sometimes it's easier for your mind to follow after your body has calmed down a little bit.
Sorry, back. Okay. Sorry, get stuck on this and I'm moving across from one to the other. Okay. So the second thing to get into is a shame-free bubble. And it's sort of like the coronavirus bubble. That's why I sort of borrowed it. It's surrounding yourself quite regularly with people that you know are safe for you, that you're going to be able to talk your shame with. That could be a group of friends, family members. Sometimes, as Cheryl found, a workplace that was open and to be educated and tolerant, and speak to people about how you're feeling about it, and know you're accepted. And that just those little bouts of shame-free bubbles can also alleviate some of that shame. Connecting with other people's stories, even seeing the two stories from Cassie and Cheryl. What was good to see in both their stories is they were living full lives. They were aware of their condition, but and they spoke to people about it, but they were living full lives. And when you can see other people doing that and connect to that as a possibility, that sort of is also empowering. One person here connected with Elsa because she was so isolated. But it's that human sense of not being alone. That's the social isolation part. So connecting with others takes away the social isolation part of the shame. Some people, if they're brave enough, which I think would be hard to do, actually go up to others and educate them. I think it's not an easy thing to do, but I think most people do respond well to it. You will find occasionally the person that doesn't. But as I said earlier in the talk, that once you understand something is not dangerous or poisonous, it does reduce disgust. So that whole education way of changing that person's experience of the odor itself can promote and make things easier, and also a bit empowering if you're able to do that as well. Therapy is another way to just basically talk about things that might be too hard to talk about to anybody else, or just explore your feelings. It's important to find a good therapist who's non-judgmental, collaborative, professional, and informed about TMAU, and that you feel engaged with. And in some cases, if the depression and anxiety are too big, you may consider some medication. And finally, self-care yourself by keeping medically informed. Support groups are great for that. Facebook pages, the TMAU Facebook page has a lot of really helpful information. I had a look at it. Make yourself familiar with things that can reduce smell, like they've suggested acidic soap, or even there's been a suggestion of an odor meter that can tell you when you're smelly and when you're not. And get a GP that's TMAU aware. Okay, so that's the end of my presentation. I hope you found something in it that could be helpful for you. And thank you for letting me talk to you today.